Chapters Health System is continuing to care for Polk County residents during the COVID-19 pandemic through Good Shepherd Hospice and Chapters Health Palliative Care. Coming up on Polk Place, we'll talk about some of the measures they have in place to protect the residents of Polk County. Welcome to Polk Place. I'm your host, Brian Lacey, and joining us in studio is Dr. Ron Schonwetter. He's the Chief Medical Officer of Chapters Health System. Welcome to the show.
Well, thank you. I'm glad to be here.
Well, sit back, relax. We want to talk a little bit about some of the things that that you guys are doing during the COVID-19 pandemic. I want to talk a little bit about what the current state of COVID-19 in Polk County and Good Shepherd Hospice service areas are, if you would, Doc.
We have been caring for patients with COVID. We had made a commitment at the onset of this pandemic that we would continue to care for patients with COVID regardless of what the outcomes were. We didn't want to have people in their communities without the support they needed, particularly if they had advanced disease or near the end of life. So we made that commitment early on that we were going to continue to care for patients with COVID.
What are some of the changes that you guys have had to do in this era of what we call the new norm? The changes that you have to do to run the business? Well,
we made a number of changes. We started late February, early March, when this was beginning to come on the forefront. We formed a work group, and with that, we put a lot of new policies and procedures in place. The protection and safety of our staff and of our patients was of the utmost importance. We ended up putting screening measures together. We screened our staff, we screened our patients, we screened their families in their homes. We're taking care of patients in hospitals, in their own homes, in nursing homes, and assisted living facilities. And we wanted to make sure our staff was going to be safe regardless of where they went. We had to secure a large amount of protective equipment. So when we have patients who are at high risk for COVID or family members who are at high risk for COVID, we need to use personal protective equipment, and that may be masks, gloves, gowns, goggles, booties, I mean everything, and respirators to make sure our staff has as limited exposure as possible. It was very, very difficult because we were probably more on the tail end of the COVID experience than a lot of other parts in the country. And by that time, getting PPE was rather difficult and actually rather very expensive. So we had a work group and did a lot of creative things, but were able to secure a large amount of protective equipment so we could be prepared. We also gave a lot of guidance to our staff as to what type of visits they should do. We moved a little forward with limiting the direct in-person visits and began to do a lot more telehealth visits where we didn't have the direct contact, but we were able to provide all of the support for the patient and family as they needed. We gave specific guidance for specific cases as to, again, what personal protective equipment to wear. So our staff felt very comfortable. We knew we needed to communicate regularly with the staff. This was really, they were pretty fearful as what to expect, what should I be doing. We communicated on a regular basis. We on our intranet, provided almost daily updates to our staff as to what the changes were, what were the executive orders that were coming out from the government, and how would we deal with them as an organization. We also needed to learn what all of the requirements were to be able to see patients in the facilities that they were in. Hospitals had different requirements, nursing homes had different requirements, and they followed some general rules, but they all kind of developed their own guidelines. So we needed to understand what we needed to do to be able to prepare to see those patients in those particular settings.
Let's talk a little bit about changes in practice in response to COVID and how it will affect future care.
Yeah, so the biggest thing is probably our use of telehealth, as we spoke about, and the feeling is that we believe the government is going to understand the efficiencies of being able to provide more care via telehealth. So I think that relaxation and support for telehealth will continue in the future. The other thing that we have learned significantly, while we do have patient direct staff who go in and do all of the visits in all of our settings, including our inpatient units, we also have a large number of support staff who allow them and provide them the support that they need to do their jobs. Administrative staff, leadership, business office, et cetera, areas where we are setting standards for the organization that we found out we were able to work remotely. We really wanted to move everybody out of an office area and wanted to make sure we were able to practice good social distancing. So a lot of our workforce became remote. While our direct patient care staff go into homes, go into settings, we do have a number of offices in our service areas, and a large part of our staff became remote, and we found out that we can be as efficient and as productive in the remote setting and be able to protect our staff as well from the challenges with COVID. So I think we're going to continue to see those changes even post-COVID, that we're going to have much more of a remote workforce. We're not going to need to be inside buildings as much as we were, and we can set up all of the communication that's needed to make it happen and to be successful in that environment. So we're learning a lot through this, actually on a positive side, that will allow us to change in the future as we move forward.
One thing that the COVID pandemic has done is shown people the resiliency of Americans and the ability to change and adapt and roll with the change. And we hear it's different when you're in television. As you watch it, it's no longer, television was a close thing. Now we've got 6 feet between us. It's definitely a new thing for us. So
it is, and we're all adjusting, and there are new guidelines, there are new recommendations from the CDC, from the Florida Department of Health, that we need to keep up with on a regular basis, because those recommendations are changing. We're getting more and more information about treatment, about prevention, about social distancing, what are good recommendations, so we have the least amount of exposure and we get over this as quickly as possible. So we've been very fortunate. Our staff has stepped up to the plate, and this can be a very fearful time, a very scary time for our staff, for our patients, but we have been very fortunate. The community has stepped up, our staff has stepped up. We've had lots of volunteers who have sewn masks for us. They've sewn gowns for us. When our equipment was low, where we didn't know where this was going to be heading, the community stepped up and really helped support us. We had to be creative, as I said earlier, in terms of getting supplies and equipment. There were distilleries that went from distilling beer to distilling hand sanitizer. And those kinds of things were a hot commodity that you really could not get a hold of. So we partnered with them. We provided them the gloves, some of the necessary materials that they needed to be successful, so we could purchase some of the supplies that we needed from them. So everybody in the community is really stepping up to the plate and making sure this is a safer place to be.
Let's talk a little bit about the changes within hospice and palliative care as Florida continues this reopen. What will we see happening?
So one of the things from our organization that we had to change early on was we had to limit the use of volunteers. So volunteers have been very important in providing respite, companionship for patients, for their loved ones during difficult times and challenging times in their lives. Most of our volunteers are elderly, and they were in the high-risk categories, and we needed to limit their exposure, so we really had to pull them out of the field much to their disappointment. They wanted to still continue to provide those services. But we needed to pull them out because we were concerned about their safety at the onset. So we will likely begin to see a little more going back to utilizing some of the volunteers because of their age group. And we know how to practice a little more safely now with the use of protective equipment. All of our visits, regardless of if a patient is at risk for COVID or their family member is at risk, we're using gloves, we're using masks in all patient visits because we do want to make sure that our staff is safe. We will begin to see some of our remote staff come back to the office as necessary, but again, we're trying to maneuver and the balance of what is the right amount to be at home, and we want to make sure our staff is safe, they're able to work 6 feet apart, and they remain safe as they navigate the buildings that they're in. Again, we're going to see some of the office staff coming back and use of volunteers. We will see a little more use of the in-person visits, a little less telehealth, and that we have been using previously, but we're going to find that happy medium where we can be productive and where the patients and families still feel supported with the care that they need during these challenging times.
Dr. Schoenwater, we have just a little bit of time left. What suggestion do you have for patients and families of those with advanced illness as they deal with our current COVID-19 situation?
So unfortunately, we're not over this yet, and we still have a ways to go. And some of the most important things to do are to continue with social distancing. People need to be 6 feet apart whenever they are in public spaces, outside of their home, outside of their own environment. When that is not possible, they should be wearing masks. In fact, it is even the most responsible thing to be wearing masks at all time when out in public, when you're going to the grocery store, when you're going to the bank, when you're going to the post office. Masks should be worn until this pandemic is over. Social distancing, again, very, very important. The typical things like good hand washing, good hand hygiene, washing your hands for 20 seconds, when you come into your home, when you leave your home, and when you use the restroom. Frequent hand washing is critical in making sure you are safe and that your community is safe also. So these are the typical common sense things that even though we're beginning to open up and businesses are coming back, it is important to continue to social distance, provide good hand hygiene, use masks, and follow these guidelines. We all want to get through this without much morbidity, mortality as we move forward. And until we have effective treatment available and effective vaccines available to prevent this from occurring, we need to follow those guidelines and be smart so we all get through this successfully.
Dr. Schoenwater, thank you very much for the information. Thank you for your time with us today.
Sure. Glad to be here. Thank you very much.
Good Shepherd Hospice and Chapters Health Palliative Care has implemented screening procedures at their hospice houses in Lakeland and Auburndale and their outpatient palliative care clinic in Bartow to ensure the safety of the patients and families as well as their caregivers. They're using telemedicine visits via phone and tablet to minimize person-to-person contact when applicable and keeping current as to the state of COVID-19 in Polk County and how hospice and palliative care will be affected as Florida continues to reopen. Now, if you need more information on what they do, you can give them a call at 800-464-3994 or look them up on the web at www.chaptershealth.org.